My name is Angel Hilton, and today is October 16th, 2024, and this is my video for catheter insertion. Just change the angle so you can see. Okay. All right. Goodness, sorry. Okay. Okay, so before going into the patient's room, I'm going to make sure that I'm going to review the patient's chart and make sure there are no activity restrictions, as well as confirm my order just before I go in, just to be prepared, and it's less I have to do in front of the patient, but then I'll do it again at bedside just to make sure. Okay, so I'm going to come in. Hello, my name is Angel. I'll be your nurse today. Could you verify your name and date of birth? And as I walk in, I would also perform hand hygiene. Okay, after they confirm their name and date of birth, I would provide privacy. Okay, I'm going to pull this curtain. And then I have an order to start a catheter today. Can you tell me if you have any allergies, like to latex, shellfish, or iodine? Okay, great. Any physical restrictions, like with getting in the position, do you think of starting the catheter today? No? Perfect. Okay, so I've provided privacy, and so I've got a little bit of extra light right here, and then I'm going to go ahead and adjust your head, and then we're going to assist you into the dorsal recumbent position. Okay, so I'm going to grab some equipment. I'm going to do some pericare, and then I'll get started with the catheter. So to do pericare, I would get some warm water and a washcloth and some skin cleanser. I would perform hand hygiene, put clean gloves on, and then I would get the washcloth and get the wound, obviously not the wound cleanser, but the skin cleanser, as well as the washcloth and warm water. Get it wet and dampen it. And I would go, as I wiped the patient, I would go this way, straight down. And then I would change to another corner and fold it around my finger. And then I would go this way. And then I would change to another corner and go this way. And then I would rinse the rag, dry the patient, remove all the equipment, clean the area, and prep it for catheter insertion. Then I would wash my hands again. Okay, and then I'm gonna grab my equipment. Okay. So when I get my Foley tray, I'm gonna make sure that it's the right size, that the expiration date is good, which everything's good here. It's already open because I messed up the first video. But, okay, so I'm going to get started. And I would also make sure I verified the order next to the patient too, as well as they were giving me their name and date of birth and all their identifying factors. Okay, I'm going to use this as my receptacle because I do not have one, so I'm just going to set it on the floor. And I would adjust the bed to a proper height. Only this desk won't move, so it's not the proper height. But and I'm also kind of limited to space here. But I would adjust it to a proper height to perform the procedure without difficulty. Okay, so I'm just going to open my sterile field right now. So I'm going to start with it away from me. Okay. Okay. And then I get my gloves. Now my gloves do have a tear in them from when I put them on. They broke when I put them on, but I'm still going to go through the motions. And if I touched my sterile field, which I would do it away, but I'm trying to stay in the camera. But if I touched my sterile field, obviously I would get rid of my contaminated and obtain a new kit. And I would only touch the outer edge of the border. Okay, so I would grab the glove by the cuff. I'm gonna try to be gentle because it is torn. Okay, and then I would not touch I would only touch the inside of the cuff. So if I can't contaminate just as I did just now, I would discard and get a new set of gloves. So, but I would stay only under the cuff. They're just kind of flimsy, but yes. Then I would open the drape. And so I would make sure that my body's not touching my sterile field. But again, it would be easier if I had the table and was able to have everything up higher because I'm kind of tall. Okay. And so we're just going to place the drape. And we'll let it fall not to touch the patient. Okay, and then this one. Oh. I wouldn't let it fall like that. So because I contaminated, I would discard and get a new one. But for the video, I'm just going to keep going for the video's sake. Okay, and then you would just drop it. You wouldn't touch the patient. Okay, so now I'm just going to prepare my kit. And so it's kind of touching some areas, and it would not, but normally if I had a bedside table, I would have more space. Okay. And so we get my bag ready. And so I'm going to face this way. So you would keep everything in the center of your field. You open your swabs. And then I would not drop my hands below my waist. So for the sake of that, instead of dropping it on the floor because it's kind of far, I'm just going to drop it over here. But that is actually the non-area. Okay, so I would put the gel here. And then I'm going to go ahead and I'm going to, before, go ahead and attach this. Okay. Let me remove this. Okay, so once this is in the gel, then I'll just place it there, and this can go here. And I wouldn't go across my sterile field. I was going to always go out and around my sterile field. Okay, and then the swabs, and then I'm going to go out. Okay, so first to clean, I would take one swab, and I would go... You do labia majora, labia minora, and then I would go out, labia minora, one swipe. So each swab is one swipe, and it would go straight down just like we cleaned. And then the meatus, which would be straight down, okay? And so at this time, I will touch a patient to continue to hold open what I've just, the areas that I just cleaned. So I would hold it open, swipe down, step out and around, swipe down, step out and around, swipe down. Okay, and then at this time I would get ready to place the catheter, but I'm going to take some lubricant and place it in the area, and then just to provide some lubricant. And they say to wait 5 minutes or so. So for the sake of the video and time, we'll just say that we have And I wouldn't sneeze. I apologize. I don't know where that came from. But if I had to sneeze or thought I was going to sneeze, I would wear a mask just to ensure that I didn't contaminate my sterile field. So because I sneezed and didn't have a mask on, I would remove everything and start over. Okay, so at this time, we're going to insert the catheter. So we're just going to go in a couple of inches. And then once we see urine, we're going to hold it in place with our non-dominant. We're going to inflate the balloon. Okay, and then we'll just kind of, once we see urine, we go in another, just a little bit further. And then we'll kind of, after you get the balloon inflated, you kind of just pull back just to make sure it's not going to like come out once you release it. And so then we'll release it. Okay, and so at that point, our sterile field is complete. So then you take your bag and you place your bag beside the bed, or on the bed, the side of the bed, and you just let it, but I don't have a place to hang it, so I'm just gonna set it here and make sure you have some slack up for your patient, and then you can secure it with, okay. And then if I would discard my gloves and my kit and everything, remove everything from the patient at this time. And then it's kind of not really got a good place to sit. My apologies. Okay, we're just gonna lay it right there for now. I apologize. I don't really have a good place. I would discard my gloves. Well, I would remove everything, get all of everything out, and then this I would tear, and then get everything out from around the patient, remove my gloves, perform hand hygiene, and if a urine specimen was needed, then I would, after I performed hand hygiene, I would put clean gloves on and obtain the specimen. At that time, making sure that I put the label on it with the name, room number, and all the information needed for the lab, and then I would send it off for the lab. That would make sure my patient was comfortable, put them back into a comfortable position, make sure everything was cleaned up, the catheter was secure, and cover the patient back up at that time. And then after that, I would just make sure they didn't need anything and perform hand hygiene and check on them in a little bit. Thank you.